We welcome the next speaker, Mrs. KAUR, Director, Midwifery, FERNANDEZ Foundation. India successfully launched the world's first maternity clinic in the Royal London Hospital. She is training professional midwives and providing clinical leadership to midwives in the FERNANDEZ Foundation and Government of Telangana to reduce maternal mortality. She has won the British Medical Journal Award and also the recipient of the 2019 Chief Midwifery Officer Gold Award, UK, for her outstanding contribution to midwifery. Her contributions to midwifery have won the state of Telangana, the best performing state in midwifery initiative in December 2022. Ma'am, over to you.
Good afternoon, ladies and gentlemen. Thank you very much. Thank you to UNICEF and thank you to the government of Orissa for inviting us. This is my passion. I'm standing here as a professional midwife. I've been in India now for 6 years, and my journey has been interesting with all of you. Today's talk is supporting birth positions of choice. Now, this is a very important subject. You've seen Dr. Avita's slides on how women are not birthing in lithotomy. And we will now look at the evidences. You will look at some videos and see how feasible it is and how comfortable women are too. Historically, women used to birth off their backs. And times have changed, haven't they? And if you look at the history of why times have changed, in the 18th century, we have CTG monitoring, so women are strapped on the monitor. A lot of times when we teach in the hospitals and when they go back to the institutions, women are not allowed to mobilize. And today's topic is all about mobility, how safe it is, and what we can do. So why is this important? And women feel that they need to be in control when they're birthing, and they feel that they need that autonomy. And WHO and several other reputable journals have also highlighted that. Some women want to kneel and some women want to stand, and they feel humiliated when they are lying down or when they're exposed, or we know that during birth sometimes women open their bowels because of the passage. So it's really important to make women feel safe and in an environment that is enabling for them to birth. And in the UK, we had a challenge, and we had all of our obstetricians in a position where they were in lithotomy. It's not a very comfortable position. Even the men tried that as well. So we know that that position is uncomfortable, and we will look into further research and go into the evidences. So why do we restrict ambulation? This is a picture of a ketchup bottle. You'll never ever get a baby or ketchup to come out in that way. If you look at a picture of an elephant upside down, it's very difficult. So these are just some pictures for us to compare it to women when they're birthing. So gravity is our greatest aid. So why are we not supporting women who want to mobilize, especially during the first stage of labor? We know that when women are upright and when they're comfortable, they feel less discomfort. So it's fear. Cultural beliefs are there as well, and medicalizations, as I've shown you, and certain myths. Sometimes when a woman has a spontaneous rupture of membranes, I've heard that they're not allowed to mobilize because this dry labor. But let's look at the evidence, because it's important that we support them and have enabling birth environments, and also look at the cultural beliefs. Choice. As a woman, choice is also very important. It's not one position better than the other. And as Dr. Avita said, if you watch an undisturbed birth, a woman automatically goes into the position which she desires. So it's not that this position is better than the other. If you let a mother move and if you let her follow her natural instinct, she will adopt the position that is most comfortable for her. And it gives her the strength and it also reduces the need for epidural analgesia or any other analgesia because she's in control. So let's listen to women. Let's respect and support. Why are we not doing that? So the one thing is, what maternity care is a woman-centered environment. Childbirth classes, women are empowered, and the times are changing. Women need to be supported. We need to now bring in the evidence-based practices, because when we are training our professional midwives and when they're going out, our obstetric colleagues also need to synchronize and practice those evidences which we are teaching them. Treat them equally and give them informed choices. So bring the mother into the conversation and explain, introduce yourself is very important, because one of our first challenges when we brought midwifery in, the commissioner said respectful care is equally important, and she's so right. And this is what women want. And involvement with the positive birth experiences. So the choice of birth positions. Now, there's a little data that has shown the outcomes of birth positions, but we know that women feel more in control. And we know, this is a stated fact, that mobility during the first stage of labor reduces interventions and also in the second stage. Mobility also reduces the first stage of labor by 1 hour and 20 minutes. Now, isn't that nice if you tell a woman, actually, when you mobilize and you move around and you use a gym ball, this is actually going to reduce your labor duration. If they want to lie down, then that's okay too. So use it, and use it to how your woman is feeling. And you're only going to do that when you know your mother and you're connected with her. So there is, as I said, no one position better than the other. A woman will choose a position of her preferred choice. And the NICE guidelines has also shown that, and we've been following it. And Gupta et al. Has also shown that if you have those positions, and it's important and it helps, okay? Everybody knows this, the power. Gravity helps bring the baby down. The passage where the baby is coming through the fetus, through the pelvis, that's really important, because when she's squatting, straight away her pelvis tilt is increased by 35%. That will help the baby to come through. And passenger, that helps the mother as well. If she's upright, she doesn't feel breathless, and she has less interventions as well. And of course, most importantly, is she has better satisfaction and better outcomes. So these are the evidences, my esteemed colleagues. Gravity helps to bring the baby down. And the baby gets better oxygenation, so the fetal heart is also improved. And it increases the pelvic diameter. I'm not saying that, this has been proven, and we've got research to say that. When a mother is upright, you are less inclined to do a routine episiotomy. And we know that my colleague will also talk about that later. And she has a decreased need for interventions such as an assisted vaginal birth. If you look at the proven facts, gravity is there. So why would you not do it? Yeah, it also reduces the risk of having a cesarean section by 30%. And this is, the day has gone, everybody's talking about the challenges in cesarean section. The intervention is having midwives, because midwives will support women to achieve that, because our obstetric colleagues are busy looking after women who are medically complex needs, which will help them. Again, I'm gonna leave this to you, and this is the guidelines that shows. And what positions can one adopt in the first stage of labor? These are some of the positions with regards to supporting a woman. A lot of this don't cost anything as well. Helping a mother to mobilize down the corridor, sitting on a chair. You don't need to get a special chair. You need to get a chair. She can sit on in the opposite position. If you don't have gym balls, you can use pillows as a substitute. And you can even use your rolling pin where you make your chapatis every day to help her to be upright and to help the position. We will go through these different positions, and in these positions, we will have videos for you to see, and these are the videos that we use for our teaching and training. So standing and leaning, and if you look at that, we have used these positions in our public hospitals where we train. We may push the cot to the corner and get a woman, help her to stand and lean. When she's tired, that standing position again helps the gravity, and the contractions are less painful. And it helps the babies lined with the pelvis and helps with descent. We have some mothers birthing in the standing up position too. So a video that will show this position. So she's standing up and the healthcare professional is helping her. She's also supporting her by encouraging her to rock from side to side. And if you look at her legs and the position, it's standing apart, so she's able to deal with that strength. And she's lunging from side to side. And the midwife is there supporting her, giving her words of comfort and telling her how well she's doing. Okay, so this is one. Walking. Again, it's the same as standing, and walking positions are very helpful when you have birth companions as well. You can walk up and down the corridor, and it moves, the movement stimulates the labor. And another video that will show you what you can do and how you can support it. And if you look, she's walking from side to side, which again helps the pelvic to enlarge and helps the descent of the baby's head into the pelvic region. If she's tired, this is when the gym ball is really, really helpful. And it uses gravity. The gym ball, I'm sure some of you have used it in the gym, it's soft. And we've seen a lot of mothers sometimes, they use it and they bounce on it. And that too helps the contractions to increase, and it helps to align the baby's head down to the pelvis. Another one is full of videos, so you need to be ready. Okay? And again, sometimes some women may feel they may fall. You can actually do it besides like a chair, so she can use it for support. And it's very safe. And if you look at the positions on how she's sitting on the gym ball with her legs at that angle, because that enlarges the pelvic region and it helps the head to descend in the pelvic area. And if you look at that, she's doing forward rocking. Yeah, she goes forward and to the back. And the midwife supports her at the back, or a healthcare professional that's available. And you can see how safe it is. She's not going to fall off the ball. Okay? And now she's rocking from side to side. Yeah? Okay? And that again helps with the forward thrust and backward thrust. And then from side to side. It helps align the baby's head further down into the pelvis. Okay? Standing lunge. And again, as I said, you can use either a chair that you have. It widens one side of the pelvis. It's usually done during a contraction. Or you can have the lunges on stairs as well, if you don't have the stairs. It helps the baby's head to rotate if the baby is in an occipital-posterior position. And this is one video that you can also show, which shows how safe it is and how it's not difficult as long as the mother feels protected. And if she feels safe with you, she's going to have the confidence to be able to do it. And if you look, it's completely stretched. The midwife holds on one side and then she lunges. And you can repeat that on one side after contraction and try it on the other side once that's over. Okay, next. All right. So the pink cloth is called a rebozo, and it helps you. It's a simple procedure that you can actually attach it to your ceiling, and you can use the rebozo as a method of support for the woman. Because sometimes if their partners get tired, they can actually use this, and it works really well. So it widens one side of the pelvis. Do it during the contraction because it helps and slowly, rhythmically brings the baby's head down. And it helps again to bring the baby down, and helpful for OP positions, occipital-posterior. Okay? Now, the all-fours position is one position that some of our mothers prefer. Then again, I must stress, there is not one position better than the other. And this position we use quite a lot, and our obstetricians in Fernandes love it when the babies are in occipital-posterior position, because we encourage the woman to lean forward. We use the simple rebozo cloth, and we shake her from side to side. And one of our obstetricians was not convinced, but she did a scan before and after we did the procedure for 2 to 3 mothers. When the babies turn, this is now a given. Get the midwives to help us to get these babies to turn. So that's something that you can try if your baby is in an occipital-posterior position. And you can also use it with pillows, if you can see that. If you don't have the cup, if you notice the tilt again, yeah. So again, it relieves backache, and for prolonged labor, it actually helps relieve the pressure. And try to use it for 30 minutes, and ensure when this woman is actually on a bed, and if she's on the floor, make sure that she has a mattress or a pillow under her knees, because that's one thing that some women might find discomfort. So again, or you can use a chair. I think they're a little tired here. There's more videos coming, yeah? Okay, and if you look, she's also resting, yeah? And we've got a simple gym mat on the floor, and that also helps with that position. So, the cat and camel. We encourage our mothers to try these positions in the antenatal period. And during the antenatal period, they actually practice them. They may not use it for labor, but a lot of times, even before, they automatically want to go into this position. So this is something, again, we use a lot for occipital-posterior babies, and the practice also helps. And another video that we can show, yeah, and if you look at that, you can also do that on the bed with the gym ball, but just look at that position. Yeah, so she's the downwards, and then she hums up. So the cat and camel. That's why they call it the cat and camel. Okay, and they find this very comfortable. Perfect. So some of you have seen the peanut ball, and we use the peanut ball quite a lot for side lying. It helps to rotate. If the mother is really tired and she's lying on her side with the peanut ball, it opens up her pelvic region. It gives her a bit of a rest, and it's a good resting position, especially if your hospital has epidurals, and that will help as well. And again, we can try that. Yeah, if you look, there are different sizes, so you need to make sure that, you know, if your mom is a bit on the smaller side, you use the smaller size of a peanut ball. And if you can see, again, the thrust and her pelvis is completely open, and she's having a rest, and it helps widen the pelvis. And you can also rock forward and on the side. And you can also bring it like a bolster and try to rock it on that position. Okay? Perfect. And you can also support her by the standing squat, and you can use that with a rebozo. That helps, and sometimes partners come in very handy for that. They lean on their partners and they squat on them, so it really helps, and you can use that. And another one, she's leaning against the wall with the legs apart, and she's trying this position with the wall supporting her back. Yeah? Sometimes some women may not feel comfortable in doing the full squats, and that's okay. They can do semi-squats, and it's all according to how she is feeling. That's the most important thing. It's also important if she's having a discomfort, then you don't try that position, because that might not be the best thing for her as well. And they feel safe because they've got the wall behind them to support them. And she's doing semi-squats, okay? Perfect. So you also have the supported sitting squats, and this is where partners or birth companions are helpful, because they sit behind them and a woman is leaning against them, and as she's squatting, it has the same concepts and opening up the pelvic region, and it helps mums. And this is one that she's using it with a rebozo. And again, if you have a partner or a midwife, she can do that, and she's using the rebozo, and she's going to do the squat. Yeah, and she's done a full squat this time. This is when the husbands are very helpful, because they are stronger, and this is when they can completely lean on them. But it helps. And if you notice, she's having 3 squats at a time, and it helps open up the pelvis region. Again, most mothers, if you look at that, what they want is to be able to position and movements to release discomfort. This is a questionnaire done to mom, and 40% of mom had said that this is what they would have liked during their labor. So reassurance, privacy, and respect, so they can do that. And positions that can take the pressure off. And it's really important that when you try this position, you may reduce the need for an instrumental birth, because it helps the baby's head to align and to descend. And even if you need to do an instrumental birth, it's pretty low, and it's not going to be a difficult one for our obstetricians. So the Cochrane review, upright positions, reduced length of the first stage of labor, a need for epidural analgesia. And if you look at upright against non-supine, you have fewer perineal injuries, and this is not me telling you, but that's the research that I'll share with you. Less vulvar edema and less blood loss. Shorter second stages, because it helps the babies to descend, and they require less needs for pain relief, and fewer perineal injuries. Now, this is really important for the perineal injuries. And we know that if you put them on the side, it actually improves their blood supply, rather than her lying on her back and in the lithotomy, because that increases perineal tears and increases bleeding as well. So if you look at upright versus non-upright, the need for forceps or suction is reduced by 25%. Now, that is a lot. You don't need to be woken up to do a forceps, because we will do it for you. And the need for episiotomies is reduced by 25%, and the fetal heart, 54% of the fetal heart pattern improves. That's because she's not lying on the flat of the back. And again, deep squatting positions, some of the studies have shown that there may be an increased perineal tears with women in lithotomy versus in squatting. So this is why we have gone away from the lithotomy position. We try to use positions that women are more comfortable in, and it also protects the perineum. The left lateral position is one of the best positions to reduce perineal tears and bleeding. Squatting on a birthing chair may have an increased risk for 3rd or 4th degree tears, but those research are inconclusive, and the research says that we should still offer women different positions of choice. So again, left lateral, 66.6 avoided tears in that position, and in the squatting position, 42% avoided tears. So just a summary, that we know that in some of the research, they said that blood loss may be increased, but those research are inconclusive, and the WHO and RCM has said that until we know with more certainty, women should be allowed and supported to have positions of the choice that they wish to birth. I would like to show you an overall vision. It can happen, and all these women have chosen the positions of their preferred choice. And let us support women, let us support each other. We have been trained to birth babies on our backs, but this is why we've got lovely documents today by the government of Orissa on how birth positions can help. And trust me, it does come, and with the right support and the right mechanisms, you will get there, and we'll support women together in India. Thank you so much.